Today's webinar is titled Understanding Innovation and Developments for National Registry Certification Examinations, presented by Dr. Paul Rosenberger, the Examinations Content Manager for NREMT. I'm going to pass it over now to NREMT. Thank you so much for being here with us today to share your knowledge and experiences with us, and we look forward to the presentation.
Hi, everyone. Thank you, Rio, so much. My name is Emily Kirchner. I am the event coordinator here at the National Registry. And I first want to thank you all for taking the time out of your day to be here. And a second big thank you to the National Association of EMS Educators for hosting us. I'm going to go over a few pieces of housekeeping, and then I'll pass things over to Paul. Today's webinar will run for a maximum of 1 hour, and we welcome questions, so please submit them via the Q&A function. We prefer them not be put in the chat. We prefer them being in the Q&A function. And as Rio said, we will answer all questions that we can get to at the end of the webinar. And we very much appreciate your partnership. And with that, I will turn things over to Paul Rosenberger.
All right, thank you, Emily. Thank you, Rio. So today we want to really talk about two topics, and the two topics are recent developments at the National Registry, and I'll spend a good bit of time there. And then we want to talk a little bit about innovation. And so I'm going to touch the EBG project. I'm going to touch a little bit on the AEMT SMC project, but where I want to spend the bulk of our time is on this concept of clinical judgment scenarios. And really what I want to do is share an experience with a scenario that is currently on our website and show you where that is and show you some features of that clinical judgment scenario. And so that's really where I want to spend the most of our time. I will direct you to that. You can follow along or work it on your own. But that's really what I want to cover today. So the first part, as I mentioned, is going to be this idea of the ALS Psychomotor Examination discontinuance. And when we talk about the discontinuance of psychomotor examinations at National Registry, I'm talking about the two levels of the advanced EMT and the paramedic, because the EMR and the EMT, those are handled at the state level. And those are not psychomotor examinations that we directly oversee. But we do oversee the advanced AEMT and the paramedic psychomotor examinations. And so as I talk about this discontinuance, I'm talking about these two levels, the ALS providers in EMS. So to kind of give you some historical significance about psychomotor examinations at National Registry, National Registry was established in 1970, and our role was to provide a national and a uniform examination for the EMS industry. As you well know, the examination had two parts. It had a cognitive part early on that was a pen and paper pencil. It was later moved to the computer, and it became a CAT or a CAT algorithm, or a CBT, which is a linear examination for the AEMT. But it also had this component of a psychomotor examination. And so this is when we went, into the laboratory areas, and we are tested on things like intubation and placing supraglottic airways and interosseous infusions and many other skills. But early on, and early in the inception of this certification examination, it did involve a cognitive component and a psychomotor component. And, back in the day, in the 70s and 80s, this was considered to be an examination that was state of the art, and it later became standard practice and part of our professional culture. And so that's kind of the history on the examination. When you look at the role, I have a table here. I know it's very busy, but when you look at that first column, it talks about the constructs that we're trying to measure. And so that is under the red header. It says construct, and we're trying to measure things like knowledge, mental skills, abilities, and those physical skills. If you move over to the right and you look at the navy blue, you'll see the very third column there talks about what are the concepts that the psychomotor examination measures today. And note that that says current. And the current examination measures mental skills such as processing and clinical judgment. When you think about the abilities, we're talking things like clinical judgment, leadership, and communication. And then there's also that component at the very bottom there of can a candidate actually perform those physical skills? If you slide over to the orange box, you'll see this is pertaining to the AEMT, what we currently test. And the AEMT with our psychomotor examination is measuring those mental skills, those processes that they need to know to take care of a patient. And also at the very bottom, can they actually perform those psychomotor skills? That is going to be shifting with the new examinations. And I wish I had plenty of time to talk about that, but I only have an hour today. But these are the constructs that the cognitive examination and the psychomotor examination currently measures today in our current time. Another important component about discontinuing the examination is the role that the National Commission for Certification Agency plays. I'm sure most people are unfamiliar who NCCA is, but NCCA is the equivalent of COA for paramedic programs. NCCA is an organization that was established in 1977, and their role was to have an accrediting opportunity for healthcare certification agencies like the nursing board, PA programs, even paramedic. And in 1989, they expanded to become the certifying board, online to the accreditation board for all professions that are measured with certification. And so they broadened their horizon in 1989. Well, what NCAA means to us is they set the credentialing standards for the certification agency. And so if National Registry wants to be accredited by the NCCA, we have to follow their standards. Their goals are to set standards for excellence for voluntary accreditation. Their goal also includes things much like ours. They want to ensure the health, the welfare, and the safety of the public. And they do this by doing an impartial assessment, a third-party validation of our practices of certifying people in EMS. And so when you look at their rules, they have standards that pertain to development of examinations, implementation of those examinations, and just overall maintenance of certification. And so NCCA is the body that accredits us to be a certifying agency. And so the decision to discontinue the psychomotor wasn't an easy decision. Really, it boiled down to, as you see here in the very first bullet here, is that the EMS community gave us a lot of feedback about the psychomotor examination and their dislike for that. I do have to preface that with there are a lot of people who dislike it, but there are also a lot of people who like it. And so when you look at people's preferences for this, you'll see that they fall into three camps. They like it, or they dislike it, or they're just kind of in this neutral area where they don't have an opinion one way or the other. And of course, continued discussions with NCCA to maintain our current accreditation. And so really by changing our examination and discontinuing the psychomotor, there's some real advantages to this. First is the evolution of testing standards. With that, we're able to be compliant. And that evolution includes research and science and just best known testing practices that are out there. Accreditation is very stringent. It has very high standards and has lots of things that we have to adhere to maintain that accreditation. We also want to align and be consistent with other healthcare occupations who are also transitioning away from psychomotor type examinations. We want to be consistent with other organizations in the certification industry. And honestly, it was just time to modernize and gain efficiencies by discontinuing the examination. One of the things I often hear is that there won't be a psychomotor examination in the future, and there'll be no verification of competency, and that's just not a correct statement because the education programs across America already do that, and there is no reason for you to abandon that. So those programs can continue to offer psychomotor examinations in the education program, but that will be left to the education program. in the end, we'll just receive a verification that the skills for the AMTs and the paramedics have been verified at the education program. And that will be maintained with an SMC document. So the big thing, the key dates, the big communication I got to get out today is when does all this occur? And the point here is the last day for the psychomotor examination will be administered on June 30th, 2024, which is about 6 months away. And so the very last psychomotor examination will be offered at midnight, June 30th, in your time zone. And what happens the very next day, July 1st, candidates will begin taking the new AMT and paramedic certification examination. And on July 1st, the existing psychomotor examination will no longer be available to candidates. And so there's really 3 scenarios here. The first one is what happens to a candidate who passes the cognitive examination and the psychomotor prior to June 30th? And the answer is those folks will be certified just like they currently are today. But the other candidates down below, the candidate who has passed the cognitive but not completed the psychomotor, the question is what happens to them? And the answer is that they will be have to move on to the new examination starting July 1 and take the new examination. And so we're doing everything at National Registry to make the examination available, the psychomotor and the cognitive examination available on up until June 30th of 2024. And then the third candidate is what happens to that candidate who's passed the psychomotor but it's not passed the cognitive. And those folks will also be have to move on to that new examination process. So the bottom line is they have to successfully complete their cognitive and their psychomotor examination before June 30th, 2024. Because on July 1st, that will no longer be available to candidates and they'll have to enter the new process. The old process won't exist at all. And we know it's a big change. And so we're offering lots of support and resources to our candidates and to the educators. A lot of this content is on our website. We are having email blasts, social media blasts. We're attending lots of national and state conferences trying to get the word out on this. And we're also trying to publish as much material in academic journals that also explain what is happening in the industry. Our goal, of course, is to have fair, accessible, and reliable assessments. And we, of course, have to maintain or work within the constraints of our policies. And here's an ask. Here's our first ask. To make sure that we have psychomotor examinations available in June of 2024, we want to make sure that those examinations are available in the 5 NASIMSO regions. And in some areas, we do need help. And in those cases, we're offering financial incentives to education programs who contract with us to offer psychomotor examinations during June of 24. There are some requirements of the contract. You would have to set your examination date before February 2024. And that's so that we can publicize that information to the nation. Those test sites must be open to all candidates, so it can't be a closed examination. You also have to offer same-day retesting. And you can also charge your candidates for the examination, but that cost cannot exceed $300 per candidate. And so the incentive after the contract is based on the number of candidates who actually attend that examination in June of 24. I'm not saying that we'll contract with everybody, but it'll be contracts with people who can provide examinations in sites where we need help with. If you have an interest in that, here is Matt Ozan's email. Please reach out to Matt. Matt can give you more details about what it takes to be fiscally incentivized for a psychomotor examination in June of 2024. Again, we're trying to contract with at least 40 sites is what our goal is. And so those 40 sites, again, are across the nation so that we have adequate testing all across the nation in June of 2024. Again, the contact on that is Matt, and Matt's email is right there on the bottom of the slide. And again, key message here, the psychomotor examination will be available until midnight, June 30th of 2024. On July 1st, this examination will no longer be available to candidates. Part 2. As I mentioned, those were that was actually the development that we wanted to communicate. Part 2 is, and 3 and 4 are the innovations that you're seeing at National Registry. So the first innovation here is this concept of bringing the latest evidence to our examinations. And so the way we're doing that is working through a national authority who's recognized throughout the industry. And this is the Pre-Hospital Guidelines Consortium. This group is consists of a board of has a board of about 13 to 14 different national organizations. They're all the organizations that you would typically think of. And they also oversee this development and this identification of various EBGs. Because of their authority and because of their widespread people recognizing who they are, we're working with them collaboratively to identify the evidence for our industry so that we can do good things, not only in the classroom and certification examinations, but also in the care that we render to our patients. And so when you look at who is doing this research, there's really some of the most outstanding researchers in the world part of this organization. And these researchers are people like Christopher Richards, Kathleen Brown, Rebecca Cash, Brimley Crow, and Christian Martin Gill. And so these folks are really on top of their game when it comes to pre-hospital care and research in that arena. Our goals for working with this group is to, first of all, identify emerging evidence for EMS education. It's for the work that you do as an educator. It is also for certification, the work that we do as a certifying body. It is also for licensure, which are the states. The states, you know, in a lot of cases, write state protocols. And we want them to have that evidence too. And then finally, the credentialing piece, which is the organization that actually employs our candidates, and then those medical directors that are also part of that process, so they also know what is the very best evidence that's out in the industry. We, as a certification agency, are going to use this to keep our examinations up to date, standardized, valid, and reliable. And the goal here is to integrate new and developing evidence into our competency examinations. We want to be systematic, we want to be transparent, and we want to have a systems approach in this process. I skipped over this, identify the type and quality of evidence, and I'll come back to that in a little bit here. To date, PGC has produced 2 documents that are very noteworthy. The first one is this 2022 Systematic Review of Evidence for EBGs for pre-hospital care. And in this particular document, PGC has identified 24 pieces of evidence that are really important and should be reviewed by educators, by certifying agencies, by the states, as well as folks who credential. And so the window that they did the systematic review is shown there. It's January of 2018, and it closed in April of 2021. And as I mentioned a minute ago, this systematic review, they identified 24 academic articles that really have great applicability and are very high quality for our industry. I'll come back to those in just a second here. The second document is the 2022 EMS Professional Reading List. And in this case here, they identified 10 articles that are highly relevant to our industry. I will say this, that the reading list is, there's actually 10 articles there. Those articles will not make it to our examinations, but it is something you should be considered when you think about continued competency or continuing education. the content of that 2022 systematic review, those 24 articles, could very well land on our examinations. And so as an educator or somebody who's developing curriculum for initial students, you really want to pay attention to what's in that 2022 systematic review. PGC is also working currently on producing another systematic review, which will be released in 2024. And so that systematic review has not been released, but it is in progress. So the big question is, well, where do I get this information at? If I want to update my curriculum, how do I do that? And PGC is the host site for this information. On the left side of the slide here, you'll see their website. It's www.prehospitalguidelines.org. If you go to the tab that says EBG resources, you'll land on this page on the right. And you'll note that there are 4 buttons, blue buttons. And the second button there is the 2022 EMS EBG Systematic Review of Evidence Summary. If you click on that, it'll take you to the document where those 24 articles are listed. Down below that, the next button is the 2022 EMS Professional Reading List, and that button will take you to the 10 articles that are on the reading list. The arrow here is saying that the information that's found in that 2022 systematic review is content that could land on our examinations, but if you're a CE provider, is content that you should be using for continued competency as well. But we didn't leave you out there on your own. And so when you click on that button, it will take you to this document. So the cover page is on the left side of the slide. It's entitled the 2022 Systematic Review of Pre-Hospital Evidence-Based Guidelines. And when you open the document, you're going to come to a page. This is actually page 2 of the document. And it has a listing of those 24 articles. And what you'll see on the very left column there is who's the author, what's the publication date. The middle column is what's the title of the publication. And then the next button, accessibility with hyperlink. If that article is free access, you can link directly to that article and download it and read it for yourself. Unfortunately, not all these articles are free access. We attempted as an organization to make these free access and pay the cost for that. But some of the publications were not willing to work with us on that, and they would not allow us to purchase those for free access for our industry. In that case there, we then indicated that it was paid access, and you still could get the article, but you're going to have to pay some amount of money to get it. If you, actually the truth is you don't necessarily need to pay for that article, because as you go further in the document, you're going to see information about every one of those 24 articles. And so as you dig into it, you'll come to pages that look like this. It talks about the title and the reference, the published abstract. But the second page here, you'll notice it has a summary of the guideline. And so here's a nice, concise, short summary of what that particular guideline says. And this is the content that you should be considering when you build curriculum to make sure that you have the latest and greatest evidence when it comes to taking care of a patient. In this case here, if you look at the title, this is Australian and New Zealand Guideline for Mild and Moderate Head Injuries in Children. And so if you're talking about head trauma in pediatric patients, you would definitely want to make sure that your information or your curriculum or your lessons are consistent with this summary that's found in this case here on page 5. So again, the nice thing is that there's 24 articles here. And if you dig through the document, you have a summary guideline as to what's important and what's not important in this particular journal article. I will tell you this, that there are, of the 24, there are 10 articles that come from the European Resuscitation Council. Those are recommendations for European paramedics. And this is information that we would not use on our examinations because we're writing a national examination for America. And so when you dig through the 24, you'll come 7, which are American Heart, which are recommendations for American providers. And then there's an additional 7 that are of what I would call a variety pack. It's just a variety of content related to clinical care for a patient. In this case, this is a great illustration, mild to moderate head trauma in children. As you move along, again, remember I mentioned there is that other button that is the reading list. And the reading list is a great document. In this case, this document has 10 articles. The methodology behind assessing the quality of the evidence was slightly different than the systematic review. But in the end, the researchers identified 10 articles with a variety of topics. And in this case, because it doesn't have all the research, the systematic review has the NAM criteria behind it in the National Academy of Medicine, which means that it's unbiased and it's very high quality. The articles found on the reading list don't necessarily have that merit badge, but they are very high quality. And as a result of that, that's why we're not putting content from the reading list on our examinations, but it is content that should be used for building CE or continued competency. The structure of this document is much like the systematic review. Again, you'll find early in the document who the authors are, the title of the particular academic journal. You'll be given access to the article itself, whether it's free or paid. And there's also, when you document the bookmark, then you can go to that document, and again, you'll see the summary of the guidelines. So the information will be there and available to you if you want to use that for keeping yourself up to date or using that for your continued competency projects. The 2022 systematic review of EBGs has been published also in the Pre-Hospital Emergency Care Journal. And here is the website and the identifier for that if you want to go read that journal article for that. And then I skipped over this a minute ago. I said one of the goals of the EBG project was also to identify the types and quality of evidence. This was a separate project that produced this table. And what this table is really a hierarchy of evidence that we use at National Registry to determine what has higher credibility than other pieces of evidence. And so on the left side of the slide, you see the quality evidence, A, B, and C, A being the highest, B being mid-range, C being low quality. Across the top, the types of evidence: is it a recommendation for care? Is it primary research? Is it informational or educational content? And that kind of helps us decide how to use evidence that comes to us. So to give you an illustration, I was an educator for a very, very long time. We relied heavily on textbooks, and you'll see that the quality evidence is a B3. And that would tell you that evidence that are found in B2 or B1 or even A are much higher quality evidence and would be more of an authority than something found in a textbook. So to illustrate that, let's say there was content in a textbook that conflicted with something like the National Model Clinical Guidelines or position statements, or even some of the structured training courses like the American Heart courses. We would give the precedent or the higher authority in that particular piece of evidence or clinical situation to the structured training course. So for instance, if there's content in the textbook talking about, I'll give you a great example, pulse oximetry, that conflicts in the textbook between the American Heart books, we would defer to the American Heart because the quality evidence is higher than that which is found in the textbook. And so bottom line is you should be looking at these structured training course textbooks and making sure that they are consistent with the textbooks, because in a lot of cases, the textbooks are not up to date with the latest recommendations. And so in that situation, we have to go to this table and decide who's the authority. Number 3, this has been a topic throughout the year. I think it was a more interesting topic early in 2023, but kind of give a little closure on this. The AEMT now has an SMC, a Student Minimum Competency Matrix. This is a document that says what is it that a AEMT should achieve with their skills during an AEMT course. Just to kind of point you in the direction of this, this is being hosted and held by the National Association of State EMS Officials. And the link is provided on the slide here. So if you want to go to this document and download it, you can see exactly what's in it. But in the end, it talks about patient exposures, patients encounters, numbers of skills for the AEMT as well as the EMT level. And it just gives you a little direction as you build your curriculum for AEMT courses. This is a national recommendation, and so I would caution you that you should also check with your state, because your state may not be following this document to the letter of the law there. They may have made some adjustments or some deviations to it, but in the end, this is the starting point for most states when they build an SMC document for your respective state. And then finally, what I wanted to do is share a scenario with you. And so I'm moving the internet over to my slide set. I hope that what you guys are seeing now is the landing page for the National Registry. And if you are, I want to show you where you can go see a scenario and all the TEI items that we're using. And so right now I am at https nremt.org. And if you go there with a browser, you'll land on this page and you'll see that it says National EMS Certification and has the 4 different levels of providers. You can go to the AEMT or the paramedic. It doesn't matter because it's found at both locations. But I'm going to click on AEMT certification. That then takes me to the details about AEMT certification. I'm going to further click on the full education program because I want to learn more. And I'll land on this page and it'll tell me about how I become a certified AEMT, and I'll give you details about the National Registry examination for AEMT. A bigger interest is this right side that says quick links, new experience and interactive performance scenario. You click on that, that will actually take you to another website. And here's where you'll be able to experience a scenario. And so I don't have time to read all this to you, but if you're following along with me, you can go there and read this later. But what happens is it tells you all the rules and what this website is and all that. But then when you hit next, you land on this page. And this is identical to what a candidate will see in a testing center at Pearson VUE. So this is our platform that delivers our examinations. This is a sample scenario. Of course, this scenario will never show up on our examinations because it's out in the public eye. But it is a opportunity for you to see the structure that your students will see when they get to Pearson VUE. And so on the left side of this page, you'll see there's an en route phase, a scene phase, and a post-scene phase. Candidates have to go through the en route phase before they can see items for scene. They have to go through scene before they see items for post-scene. So they have to move through this methodically to see all the items with this. In this scenario here, we actually have 13 items. Really, we're trying to showcase the items and the phases for this scenario, but we'll march through this. So the candidate is given this. It says en route. So they're given information about an incident. They're told things about the environment, who they're responding with, the crew configuration, the hospitals, locations, and all that kind of stuff. And then to the right is their very first question. And so this is written here en route. The question is labeled en route. And this first question here is a multiple response item. And this is on our test today. We've been using these for years. This one asks the candidate, in this case, identify the dispatch information cues that the AEMT should prioritize for response and scene readiness. and they should select 2 answer options. You guys can do this on your own. I'm just going to click on these to move through it. But the instruction here is to select the 2 answer options that are correct. I'm not saying those are correct. I'm just clicking. And I hit next. It then brings the second item. I cannot go back to the first item because I've answered it. And it asks them their second question about this en route phase. This item here is a multiple choice. They would select 1 answer option, and then they would hit next, and they would go to the third question. Again, this third question is another multiple choice item. They would answer that question. They would move to the next item. And then you note, after I answered that third item, the tabs lit up differently. Now the information about the scene has been introduced to the candidate. If they want to go back and look at the en route information, they can, but they can also look at the scene information. So they would read this information about the incident. They would then answer the next item. This one here is another multiple response, so it's asking to select 2. They would do that. They would then go to the next item. Again, note scene. They would select 2 answer options. They would hit next. And then here's really where I want to land. They would then see an item. This is called a drag and drop. And so this item's asking them to do something with dragging and dropping content. And so in the nutshell, this item's saying, well, what's this emergency? If you read the scenario, it's a hypoglycemic incident. And it asks them to also relocate what is the therapy for this hypoglycemia, and it would be to administer dextrose. So they drag those over, put those in position. And so this is our first TEI. This is called the drag and drop. They get another item. This one is a multiple choice, so they would answer that, move on. They're still on scene. This one is a multiple response, so they'd answer 2 answers. They would move on. And now that I've answered those, you see that it has now shifted to post-scene. So now there's new information about what happens post-scene. And so they can go back and look at the scene information. They can go back and look at the en route information. But in this case here, these questions are pertaining to post-scene. And so again, we have another multiple response. So they would answer 2 answers, move on. This one here is another multiple response. They'd move on. I'll show you here, if they want to pick 3, the computer's not going to let them do it. If they want to only pick 1, the computer's not going to let them do it. So nope, you got to pick 2 answers. So there's some help in here for the candidates. In this case, this is a multiple choice. And then the second item, the second TI we're using is a build list. And so this one's asking them, well, what's the emergency here? You know, what's the most likely emergency? What's probable and what's not likely? So when you read the scenario, this is a hypoglycemic incident. I think the patient has a chance to have a hypertensive emergency, and the patient clearly is not cold. And so they would order those. And when they have those ordered to their liking, then they would submit their answer, but they can also move them around if they want. So they can shift them down, move them around, that kind of stuff. But this is a build list. They would hit next. The other option here is called an options box. And so we're asking to put things in different buckets. And so this question asks, well, okay, if you're taking care of this patient, how do we know things are getting better? So if the heart rate increases, that's probably a bad thing. If this patient who has been altered now follows commands, that's a good thing. If this diabetic patient, their skin becomes warm and dry, that's a good thing. If they have a seizure, that's a bad thing. And so they would order the items that way and hit next. And then you'll see what happens is now the demonstration is complete. And the reason why I wanted to show you that was so that you could see the scenario, the different item types, and you can go in and play with that yourself when you have more time. I had to demonstrate that in rapid fashion, but anyways, that's out there available to you. That is found on our website. Before we go there, I wanted to let you know that I was only able to talk about 4 things. We have many things going on at National Registry. If you click on this QR code, it will take you to our website, particularly on our key initiatives. And I believe there's about 8 different key initiatives. There may be 9 now. But it will give you a little bit more description as to what we're doing and give you details about what we're doing and take care of some of those key initiatives there. So this is super helpful if you want a little bit more information about what we're doing at National Registry, because it'll take you to all of our key initiatives that we are undertaking today. And with that said, I'm going to shift back to the previous slide and see what questions we have.
Okay, Paul, the first question comes from Christy Kuba. At the conclusion of the psychomotor exams, will National Registry make the scenarios available to the states in a secure manner? If so, when would be the earliest they would be available for release?
So we have discussions about that. We will be trying to turn those over to the states in the months of July and August, because we will debrand those scenarios. And again, we'll keep them secure for the states that want to use them, but we'll be turning them over as quickly as we can.
Let's see. Next question comes from Benny Hearn. How will this affect those seeking recertification or old folks that are state licensed but desiring National Registry certification?
If they try to re-enter and they've expired, then they will be required to take the new examination like any other candidate.
Okay. Would you go back to slide number 9, Paul? We have a couple different questions that could be answered by that.
Yeah. It shifted on my other side, but not this side. But at least I know which slide we want to see. That one.
That one, yes. Yeah, so the first one comes from Jeff Morgan. To be clear, if a candidate starts the psychomotor and needs to retest, but it is after July 1st, will they not have to, or will they have to start the new exam?
They will have to take the new examination, which is one of our communications that we need to get out, is that not waiting till June is going to be the best path forward. So we're encouraging education programs to test as early as April, May, and really not waiting till June, because as June moves along, that window closes down and that candidate will have fewer and fewer opportunities to take a psychomotor examination. So a lot of schools, I know a lot of schools, a lot of states, if they're finishing in late June, they're pushing those candidates to take the new examination starting July 1. So again, I think that becomes a strategy that the education program and the students have to have dialogue on and figure out what the path forward is for them. Particularly if a program ends, let's say June 25th, the best strategy may be for them to wait till July 1 to take the new examination. Because if that's the case, they would only have, 5 days to get through a psychomotor examination.
Okay. Thanks, Paul. And staying on this slide to answer James Hell's question. So at one point, if you took your written test before July 2024, you would have until July 2025 to do your psychomotor. Is that correct?
That was the sunset, when we were sharing this idea that we were going to offer a sunset period. Yes, you're right. That was a 1-year period. Our board and our leadership has had lots of dialogue on this, and with NCCA and with the industry. And we have closed that window. So this is like on or off. It's on, the psychomotor examination is on until June 30th. It is off July 1st. There is not a transition period. So you have to get your psychomotor and your cognitive done before June 30th. Otherwise, you have to enter into the new process July 1.
Thanks, Paul. The next question comes from Benji McCollum. When will AEMT switch to CAT from the linear exam?
It's a great question. I don't see that happening anytime in the foreseeable future. It has a lot to do with producing these examinations and examination volume. And the AEMT examination is one of our least taken examinations.
Okay, the next question comes from John Athens. On the multiple answer questions, does the student get partial credit for any correct answers, or is it all or nothing?
It is all or nothing. The questions are written so that there are only correct answers and incorrect answers. And so there's also, if you notice on the instruction there, it said select the 2 answer options that are correct or 3 answer options that were correct. So we also tell them there are 2 correct answers here. You have to pick those 2. A lot of other certifying bodies just say select all that apply. And we felt like it was better to tell the candidate that there are 2 answers that are correct or 3 answers that are correct, as opposed to saying select all that apply, because we felt like that was more fair. But in the end, we don't offer partial credit because if it says select the 2 correct answers, that's telling you that there are 5 answer options. Only 2 are correct, the other 3 are incorrect.
Okay, the next question comes from Rochelle Goldberg. Will the scenario questions on the NREMT website eventually give answers with rationales?
We are updating that scenario. We will have a scenario, it's going to be the same scenario, but there are going to be items that are AMT level, and then we're also going to add on items that are paramedic level, which will also actually introduce more items available publicly. We will not be offering the answers to that. The reason being is that that particular scenario was written in-house, and the items were also written in-house, but they have not been paneled, meaning that what we do with our scenarios that will be live and operational is they do go through a panel of SME experts to make sure that the items are correct, fair, and we also provide rationales and references for every single correct answer and incorrect answer. And so this is just a tool for educators and candidates to see what a scenario is and experience the different item types that we use. And those, again, are multiple choice, multiple response, build list, an options box, and a drag and drop, those 5 items.
Thanks, Paul. We have a couple different questions about how many scenarios there will be on the test.
Oh gosh, that I'm going to answer it. That's still we're still determining what the quantity is going to be. Do understand that some of the scenarios on July 1 will be operational, but we will continue to pilot new scenarios as we build them and construct them. So that remains to be determined as to how many pilot scenarios will be on the examination. So I don't have that answer today, but I can tell you there will be scenarios that are operational that count come July 1, but there'll also be scenarios on the examination that will be piloted, and they won't count for the candidates passing or failing.
Okay, the next question comes from Leah Tilden. Will the new item types also be on the EMT and EMR exams?
The answer is yes. We are using the 3 new item types, the TEIs at the BLS level. I will be honest with you and say that we have not built a lot of those at that level today, but they are coming because our focus has really been this ALS content for AMT and paramedic, but it's not out of bounds for us to use these at the EMR or the EMT level yet.
Okay, Jennifer Goodson asks, will there be a price increase for the cognitive exam?
Yes, the examinations will have a price increase because the sitting time at Pearson VUE will be longer, and Pearson VUE charges us by time for an examination.
Okay, the next question comes from Brad Reddle. Do you have a list of the paramedic NREMT drugs that are covered on the exam? And do you have a preferred drug book that you suggest for paramedic drugs that are covered by the exam?
Yeah, we do not have a drug book. We do not use any particular textbook. But I would tell you, if you remember that table that I showed you a couple slides back, one of the key documents that we use to write our examinations are national documents. And so the National Scope of Practice, the National EMS Education Standards, and the NASIMSO Model Clinical Guidelines give us a lot of direction as to examination content. And so if you look at those three documents, you can kind of see a nice variety of medications that are in those documents that could be helpful when you try and teach medications in your education program.
The next question comes from Adam Knight. How many questions will be on the AEMT and paramedic exams?
To be determined. Again, it has to do with examination length. And honestly, it takes a candidate a little bit more time to answer a TEI item than it does a multiple choice and multiple response item.
Okay, a couple people have asked for access to the slides and some tables that we've covered. A copy of these slides will be sent out by NEMC following the webinar, along with a link to the recording. So you all will have access to this information. Let's see. Okay, another question comes from Susan Urich. Will the registry be offering any education programs to help the AEMT and paramedic educators prepare their students for the new exam format?
We are, again, we're doing social media, emails. We're speaking at every conference that will have us, national and state. We are trying to, this one's a little bit out of our control, but we're trying to publish articles about how do you build these type of examination items in your program. Again, that is conditional on the academic journals accepting those. We had a vendor summit last summer where we shared information with the various vendors, primarily the book publishers and people who prepare candidates for examinations. I think we're doing as much as we can to share this information so that you have the resources you need to build your curriculum with.
The next question comes from Benny Hearn. Will returning or recertifying paramedics need to validate skills since they will not have a portfolio?
Our board and our executive leadership team are having those discussions now, what that will look like going forward. What counts as a skills verification and when is really probably also the bigger part of that. So those discussions are going along right now.
Okay, the next question comes from Daryl Crooks. Will a student be able to take the cognitive test? Will the student be able to take the cognitive test after the classroom is completed, but clinical time is still ongoing? Or does the student have to wait until everything is completed to take the test?
That is state by state. So the states control a lot of that. And so I would have to defer you to your state to see what their rules and regulations are on that.
Okay, the next question comes from Mike Harris. Will the EMT cognitive exam also be changing on July 1, 2024? The literature listed AEMT and paramedic, but not specifically EMT. Is the EMT psychomotor that is administered by the state sunsetting as well?
No, the states will continue to control EMT and EMR psychomotor examination and competency. We currently do not do that. That's overseen by the states. And so if your state requires a psychomotor examination for EMR, EMT, I don't see that changing. Of course, there's 50 states out there and I can't speak for 50 states, but I would defer you back to your state, but it will not be changing for us. Will the cognitive examination for an EMT or EMR be changing July 1? The answer is no. This discussion is only for AEMT and paramedic.
All right, the next question comes from Peter Hosendale. For the clinical judgment scenarios, if a candidate indicates an inappropriate treatment during the scene section, will it alter the post-scene information given?
No. So when you look at the tabs that en route, scene and post scene, that information never changes. And so the items are being written so they're standalone, so that if you do something, let's say you're on scene with a patient and you deliver some type of care that's inappropriate, the next item you see will not be dependent on the item before that. So they're being written so that they're independent of what happens before that.
Okay, Michelle Hurtado asks, will there be specific feedback given when giving a fail report to candidates besides categories or a point system per category tested?
No, I don't remember which month it was. It was spring, summer, where we rolled out the scaled scoring reports. Those reports only go to candidates who failed the examination, and it tells them where they are in comparison to 950, which is the passing score for the examination. So they will get the feedback on where they are in comparison to the bar, the passing number of 950.
Okay, Chris.
And I will say, we currently do not give feedback to candidates who passed the examination.
Thanks, Paul. The next question comes from Chris Ruggiero. Does National Registry have plans to offer workshops, templates, and/or guidance for constructing TEIs in the future?
I will tell you, we've done several of those already. We continue to do courses. For instance, NIMSI is a great example. Last year at NIMSI in Reno, I don't know how many courses we delivered about item development, probably about 4 to 5. We are also submitting about 4 to 5 topics for NIMSI in Pittsburgh this year, and so we're at the venues offering this information. Again, we're trying to have this stuff published as well and put this content on our website.
Okay, we only have time for a couple more questions. The next one comes from Ginger Oviet. Are the questions weighted in such a way that if you correctly answer more difficult questions, the candidate would get more points and ultimately have less questions?
Ooh, that's a complex question. So the paramedic, we use a computer adaptive testing algorithm. And so the test adjusts to those candidates' ability. And when it reaches a 95% confidence interval as to competency or incompetency, it does turn off. The answer is those items they have varying difficulty levels to them. Whereas the EMT, or I'm like the AEMT test is a CBT, which is a linear examination delivered through the test. And so they answer a series of items on the CBT test. And then the calculation is done to determine if that was competency or not. So I guess the answer to your question is, are some items more difficult than others? Absolutely. But I don't know that it doesn't have an impact on the CPT test. It's just a matter of, did you prove up the competency on the CAT? The CAT algorithm is adjusting to the candidate based on the items that they're answering.
All right, we have time for one more question. And if we didn't get to your question, I will post a email address, support@nremt.org, that you can direct your question to get answered after the webinar. Our last question comes from Edward DeFusco. How does one become involved in participating and creating questions for upcoming exams?
Great question. Well, I hate to do this to Matt, but if you have an interest in that, you can reach out to Matt, and we can get you on upcoming panels. I do have to tell you that we do have geographical representation, and we do embrace diversity, inclusion, and equity. And so we try and make our panels reflective of the industry. And so if I had a bunch of people from Texas say they wanted to be on the panel, I could actually only use one per panel from any given NSIMSA region. And so it is a puzzle, and we try and get as many people involved in this process as we possibly can. But we do have some limitations. So I would tell you, if you have an interest in this, email Matt here, let him know. We will get you into this program called Lineup. And when we get you in there, that then allows us to select you for upcoming panels.
Fantastic. So we are past the hour here. So that concludes our webinar. Thank you so much, Paul, for the great presentation. And thank you, Rio and NEMC, for hosting us.
Yeah, thank you for attending.
Yes, thank you both so much for being here with us today. We truly do appreciate our partnership with the National Registry. Everyone, I know there was a lot of concern, but I have everybody's email address that was here today. So tomorrow you will receive the follow-up email with all of the important information today, including the email address to submit your comments. All right, so on that note, I hope everybody has a great rest of your day, and we will talk to you next time. Thank you.